Well, Eyewitness News is your vaccine authority, and we are continuing to get questions on COVID-19 and the vaccines. Channel 3's Irene O'Connor spoke with an expert at Middlesex Health to get you answers.
Joining us now to talk about the vaccine and some of our viewer questions is Dr. Alina Filozov from Middlesex Health. She is the Chief of Infectious Diseases there. Thank you so much for being with us.
Glad to be with you.
We have a couple of viewer questions, actually 3 that we'd like to get to today. I know so many people have questions about the vaccine as more and more people get vaccinated. Josephine Perry from Brantford wants to know. She says, I just got my shot last week and I just stopped taking my blood thinner on Sunday. Should I be concerned?
So, of course, my next question would be, what kind of shot did you get? Did you get one of the mRNA vaccines or J&J vaccine? But either way, you should not be concerned because the risk of clotting, if we're talking about Johnson & Johnson vaccine, is really small. Compared to all other risks that can bring you clots, this would be a low risk. Now, if you were to develop shortness of breath or swelling in the legs or some other unusual symptoms that you need to touch base with your doctor, go ahead and do that, but you should not be worried.
Okay, of course, Johnson & Johnson, that vaccine was put on pause. So a lot of people have questions about that, but you're saying that side effect with the blood clotting is extremely rare.
It is very rare. Now, in nearly 7 million doses, there have been 6 cases, and all of them were women, and all of them were less than 50 years old. So it seems that there is some kind of an immune issue that's related to the vaccine itself. But again, even in those situations, the risk of that clotting related to this vaccine is extremely low.
Okay, next question comes from Suzette Mashi of Winstead. She's asking, if you're allergic to shellfish, can you safely get the vaccine?
Yes, you can get any of the 3 vaccines available right now. Any allergies, including severe allergies, is not contraindication to the vaccine unless you're allergic to specific portions of the vaccine itself. And if you have severe reactions from other things, like shellfish, you should just let people know, the ones that vaccinate you, so you can be observed for half an hour after the injection.
Okay, and that's different from when you usually get the vaccine. It's just a little bit longer.
Yes, 15 minutes. Yeah, 15 minutes for everybody else, 30 minutes for those who have history of very severe allergic reactions to any other components of the vaccine or any other vaccines in the past.
Okay, my last question, the last viewer question comes from, and it's actually about arthritis. This actually comes from Bertha Cyphers in Union. She wants to know, how does the vaccine interact with arthritis?
Vaccine will not give you arthritis. If you do have arthritis, especially autoimmune arthritis, and you're taking medications to depress your immune system, you should be one of the first ones to actually get the vaccine because your risk of having severe COVID is very high. So vaccine itself is not going to cause arthritis. It's not going to worsen your arthritis. And you should still get it if you have arthritis, regardless of what kind of arthritis it is.
Okay. I had a question myself just about some of these conditions. You know, a lot of these viewer questions are about conditions. Should you consult your doctor before you get this vaccine? In any case, if you have any other conditions, underlying conditions?
Well, it depends. So if you are receiving medications that depress your immune system, there may be some things that your doctor can stop and hold so you get the best response to your vaccine. But it's really, the discussion is really just the timing of the vaccination, not whether you should or should not get the vaccine. The vast majority of people should be getting the vaccine and should be interested in getting the vaccine.
I really appreciate your time today. Thank you so much for being with us, Dr.
Of course.
Alina Filozov from Middlesex Health. Thank you so much.
Thank you very much.